Hi, my name is Ruth Mjoa and I'm on Team Distancing Devices. And my teammates are Austin, Lauren, and Chikumbuto. I'll be presenting on one of our prototypes, the intubation box. So intubation is a process in which an endotracheal tube is inserted into the airway of a patient. And once connected to equipment like a ventilator, it aids the patient in breathing. So during this process, healthcare workers are at risk of contracting COVID-19 due to aerosol and droplet exposure. So due to the rise of COVID-19 cases, powered air purifying respirators, which are ideally used in this process of intubation, have become scarce. But also due to their very high cost, which is $1,800 each, these equipment are not available in most developing countries. And most healthcare workers in these countries use other forms of PPE which are not advised, such as N95 masks, which do not provide optimal protection from aerosols and droplets. So the intubation box has been designed to shield physicians from droplet and aerosol exposure during this process of intubation. So the current design is an acrylic box with armholes that sits over the patient's head. The design is rigid in nature, but it allows movement required for the process of intubation. And the rest of the box is covered using a plastic sheet. The design is ideal because it is low cost, which is about $60 each, and it is simple to manufacture on a small scale.
Hi, I'm Lauren, and I will be talking about our work during the internship on our intubation box. So after some initial research, we determined our design criteria, and this was based off of customer needs. So these were, it needs to be compatible with the intubation workflow, and this is determined by the diameter of the armholes and the size of the box. It needs to be able to be used in a variety of patients with a large size range, whether that be age or weight. It needs to be easy to clean so that it can fit into the sterile environment. So it must be disinfectable, and it can't be really difficult to clean and intrude on the current workflow. It needs to be affordable, as this will be implemented in low resource settings. We're looking at the availability of the material, as shipping during COVID-19 is especially difficult right now, as well as the cost of one device that should remain under $75 to be comparable to what else is on the market and to be affordable for the low resource setting clinics. The intubation box also needs to be effective and actually reduce infection risk, and this concerns if it is vapor or droplet tight, and we're looking at a significant droplet reduction compared to intubating without the box. And lastly, our intubation box really needs to be ergonomic, which means that it needs to be comfortable to use and doesn't put excess strain on the physician. So for this, we're looking at comfortability. And this would be a user-defined scale, so a survey someone would fill out of how comfortable the device is to use, do they experience strain compared to the normal procedure, if their work is inhibited anyway by the box, and important user-end feedback such as that. Using our design criteria, we broke down the problem into a problem decomposition using our inputs and outputs that we found to be most important. We decided to focus on the user end of the intubation box. So this means that the box is placed on the patient, and then the intubation process occurs where they're adjusting the box of table position, secure the draping on the back of the box, placing the equipment into the box, performing intubation, and then once the equipment and physician's hands are removed, the biggest output is that, or the most important, is that the patient is intubated, and secondary droplet transmission is reduced, which is one of the main goals of the intubation box. Using our research and our problem decomposition, we started brainstorming some ideas. So this concerned different shapes or different features that we thought could be added onto a device. So this could be a slanted front panel to help with ergonomics. a pop-up tent that is easy and intuitive to use and folds up for storage, as well as a gloves box that attaches the gloves to the intubation box to further reduce droplet transmission through the armholes. So a lot of these ideas we continued exploring and continued working on. Using everything we had learned thus far, we have our final recommendations for the design studios. So this involves many different structures or design aspects. So on the left is a slanted front panel, as we previously were considering, to help with ergonomics, an extra hole for nurse engagement so that they could also have a hand in the box. Going back to the structure of it and the ergonomics, we're considering the benefits of having a side hole versus a front armhole. And then we're also considering and recommend different material for the side panels, as it's not necessary for them to be clear, and this would decrease the cost and make it easier to manufacture. On the right are two different structures we've brainstormed and thought of the ideas. So this is a folding box. So this is one piece of plastic that's folded and scored so that you would fold it together and attach one plastic clip, and this keeps the box together so you could fold it up for storage, and it's also very low cost and simple to manufacture. And a simpler design that's a little more difficult to manufacture, but achieves the same purpose as the hinge box. So this is the acrylic panels that are currently used or similar plastic with metal hinges and a clasp to put the box together, so that it could be unfolded for storage but easily put together for surgery or whenever intubation is necessary. In addition to our final recommendations, we have a few future considerations that we did not believe to be priorities. However, they are different aspects that should be considered in the future. So this is concerning further reducing the droplet exposure, concerning adjustability as well as safety. So for adjustability, we recommend having two different size options available, one for adult and one for pediatric. And for safety, we recommend filleting the edges, which means rounding them off to make them safer to use in the sterile setting. And to further reduce droplet exposure, we have a couple different ideas, such as a reusable neck covering, swinging armhole covers, or a magnetic ring that attaches surgical gown arm sleeves into place to further reduce the exposure. Thank you for watching, for listening to our work on the intubation box.